So how did you become a physician?
I became a physician because number one, I definitely had the passion.
Okay.
I loved, I loved the whole aspects of healing, and I had some really good mentors growing up. My own doctor growing up was a doctor of osteopathic medicine.
What's now osteopathic?
Osteopathic medicine is a type of medicine where the medical field focuses mainly on the entire body.
Okay.
So you focus not on just individual organs, but the body as a whole. Would promote wellness and natural healing.
Okay.
And as well as in how the musculoskeletal system, the nervous system ties in with all the rest of the body, basically.
So you were exposed to that, when?
At a young age, my doctor growing up in high school and in college was a doctor, and so I had some really good mentors, and I just had a passion. I mean, when you do biology and you want to stay a little extra in class and you want to do a little extra in reading.
So were you always? So it was always you always wanted to find out more about the body and things like that. You were just around that environment okay, that's
all
pretty
the time.
cool.
When I was in third grade, my science project, when I was 9 years old, my science project was how the muscles of the bicep worked. This
Really?
versus this.
So you weren't even scared of dissecting little animals and trying to go through all that
fun.
when it gets to that, and okay, all right, because there's the things that you see that people just can't stomach, but you were all into that.
Yeah,
huh?
I was all into that. I just thought the body was just an amazing thing,
All right, that's cool. Now you mentioned something about New York University. What's going on? So you're out here in California, and 100,000 Oaks, and you're getting ready to move over to a new location.
On Rolling Oaks Drive.
Rolling Oaks Drive.
Moving over just up the hill there. But we originally are from New York. I moved here from New York.
Okay, so tell me a little bit about you were in school there in New York?
I did. I grew up there my whole life since
Okay.
I was a little child. I went to high school there, went to college there, went to med school. I did my residency training at Stanford University in Connecticut, which is an affiliate of Columbia College of Physicians and Surgeons. Did my residency out there, and we used to come out to California all the time just to kind of visit. And my husband had some work out here, and just love the lifestyle. We're very healthy, we're very outgoing. We like a lot of we love fitness. That's our main thing.
Okay.
So when we came out here, we saw the opportunity to be able to go hiking and biking and swimming and skiing all year round.
So I think what I'm getting to is, because I'm from the Midwest, and so the cold weather back there
it was
not allowing all those things.
It was limiting. And on top of that, I had a baby somewhere in, right after med school, before residency. And when you have a child at home, and you have to stay either bundled up or it's so hot for a good, 9 months out of the year, we just couldn't do much. And life here is just nice. It's outdoors all the time. And where we live, within a couple hours, you're skiing, you're swimming, you're everything.
A day like today
is a big deal, right? Terrific, and it cools down by then. So lifestyle definitely was a big factor. Quality of life, I think, is really.
Did you have your practice back there?
No, I was a chief resident at Stanford. So I was finishing my residency.
Okay.
The opportunity came up to move across the country, and we took it. So the hard part about that was, what was I going to do once I got here?
Yeah.
How am I going to start a job, or what am I going to do? So I had my second child by the point that we moved here.
Okay.
And the first thing I did was I started looking for jobs. As an internal medicine physician in a group. And what happened with that is, my primary goal was to somehow balance motherhood and medicine. And the question was, I can move across the country, now I'm living in this beautiful place, how am I going to balance that, because as a woman, you want to be a good mother, you want to be there for your children, you want to be able to attend all their little events, but as a doctor, after so many years of training, I was hungry to be out there working and taking care of patients and, really practicing medicine. So I started interviewing for jobs, and I couldn't find the balance in any of the offers I was getting, and there were big groups, and it was really hard for them to sort of allow someone to be able to work part-time and balance. And
With the big groups were more of a political thing, you think?
somewhat, and
you don't have to go off and say it.
right, and otherwise it was just medicine is not a part-time job, right? You're never off. You have to be there for your patients, and they trust you, and you're their doctor. And the reason I went to internal medicine is to take care of all of you, the whole body and so if I'm gonna be a primary care physician, I have to be available all the time. It's not like I can just go in, do a surgery, and be done. I'm there all the time.
So your first practice came when you first what made you start Well, actually, okay, you applied for all the groups.
Yeah.
So
and I decided myself it wasn't going to work for me.
Oh, I see.
So then what I did was, which I now encourage a lot of young women to go out and do, is I started looking for anyone in the area who is a female physician who's on her own.
Mm-hmm.
And so that's what I started doing, and I started making a lot of phone calls and talking to people, and it just empowered me.
Just trying to see how it's done, right?
Yeah, and I said, you know what? I can do this. I can do this on my own. I can be a mom. I can be a doctor. I can balance the two, and the way to do that was to start my own practice.
Start your own practice.
You know, and it wasn't going to be easy, right? It takes
Well, what
years.
challenges did you face starting your own practice?
Financially, of course, you know, just like any small business. So finances are obviously, you know, pretty big, and setting up everything from equipment to staff that you need. And the second was promoting yourself. You know, nobody out here knows who I am. They don't know what kind of doctor I am. And it's so doing a little bit of marketing. But, you know, when you provide good service, people come to you. You don't have to go out and market yourself. You know, you take care of a patient, you take care of their families, they'll recommend you to 10 others, and you know, and that's how you build your practice.
I see. And now because you're moving over to the new area over in the new facilities over off of
Rolling Oaks Drive.
Actually, you get a ranch road over there. Okay, Rolling Hills. I gotcha. Okay, and then but because your clientele is expanding.
Clientele is expanding, and you know, it's just keeping up with the facilities, and we're going to be going into electronic medical records and having an office kind of, you know, hardwired for being able to do medical record keeping electronically. You know, you got to change with the times. So
now, for examinations, what would you recommend for female and men? Something that you think that, you know, it should be a yearly, like utmost important. Starting with female, what do you think each year should be that you see that is pretty common that people really females need to focus on every year as far as taking care of themselves? What would you say?
I think first and foremost, you know, getting an annual physical, doing a good physical with your doctor. Women should always have a gynecologist too, or at least a doctor that can do both. You know, it's hard to. The number one thing I think is definitely heart health. I think that goes underdiagnosed in a lot of women, and heart disease does go underdiagnosed. Is it
because you see a lot of diets that are just not?
Diet and lack of fitness. No one has time. I mean, we live in this beautiful place where you can do so many active things. But what's a typical life like for a working woman? You know, get up in the morning at 6:30, get her kids off to school, go to work all day, come home, get her kids, cook dinner, go to bed.